lots of questions about the cost of dental implants. So what affects the cost?
So there's a lot of things that affects the cost, but the first thing is the implant itself.
Okay.
It comes in different sizes, different varieties, and pretty much, if you buy knockoffs, which we don't do, implants that are FDA approved, a lot of things come into the cost of the actual implant itself.
Okay, so that's one cost.
Correct. And the next thing is pretty much the number of doctors involved. I am the sole doctor. You're not having to go anywhere. You're here in my office. We do everything from A to Z. There's no additional fees and costs because you're having to go here and there. There's one set fee and that is it.
Now you told me how it's typically done is in 2 different offices. One person, like the oral surgeon that you are,
Correct.
does the surgery, and then another office that puts the teeth on top.
Correct.
So you do it all right there?
I do have it all because of my restorative, my teeth design capabilities, as well as my surgical skills. So I'm able to take a patient through their entire journey from A to Z. So the next thing that affects the costs, and I do have a list here so I don't leave out anything, is the extent of the surgery required. Everyone's different. Nobody's a cookie cutter type of patient. Everyone's the length of the surgery, the type of surgery you're going to need, whether bone grafting is needed, everything affects the surgery outcome. Whether the patient's going to need bone grafted, whether they're going to need tissue grafting, all that comes into play.
Okay.
So the next thing is pretty much the the technology that's used by the doctor, which is pretty much the laboratory. Is there a laboratory inside the office? At our office, we do. We have a full lab, and we are able to 3D print the teeth right there in the office.
Like making and printing the teeth
patients,
in office?
They don't have to go anywhere to go get the teeth.
Okay.
They wake up, and the teeth are ready for them. So that cuts the cost back, so they're not having to go to another person.
And time?
And time, definitely time. The other thing is insurance coverage. Although we participate with numerous insurance companies, many a times insurance companies don't pay for this.
Yeah, what does insurance cover? Like if you have really good insurance?
So a lot of insurance only allow you like a couple $1,000 a year to spend. We will, as a courtesy for you, we'll file your insurance. Whatever the insurance pays, we'll give you the money for it.
What about Medicare and Medicaid?
Medicare and Medicaid will not cover for this type of procedure. I get this all the time. Patients will call and say, hey, I heard this is going to be covered by Medicaid, Medicare. It's not covered. It's just not covered.
Okay.
So the next thing would be the material of the teeth. What are you going to go home with? So what are your final teeth going to be made of definitely determines what the cost is going to be. I give you zirconia, which is a very high-grade porcelain. It's nothing cheap whatsoever. A lot of office will, downgrade the material and charge you less, but it's not a guarantee of the material.
Like they're made out of denture teeth, like
it's
acrylic
like acrylic, and it can break down, and they can bite, and the teeth can crack. You don't want that. That's a huge investment already that you've made. You want something that's more final. And zirconia is an amazing material that we offer for all of our patients. We don't offer any of the cheaper materials whatsoever. So the next thing is the snap-in, snap-out dentures. And patients can resort to using this if they're in a fixed budget.
But it's a lot, or a little bit less.
It's a little bit less, but there is a maintenance cost. Because some people think, okay, I got these teeth that aren't moving anymore, and that's great, but you're still limited in what you can eat. You can't just eat anything with these snap-in, snap-out dentures.
Okay.
It just helps your dentures not move around. But again,
it's still a denture.
It's still a denture. And with the little plastic housings that are inside the denture, there's a maintenance cost because you have to change those out every year.
Okay.
So just, be aware of that. But it is an option. So the last thing is the experience of the doctor. I can confidently say I've done a lot of these cases, and I'm able to do both the teeth design as well as the surgery itself. My patients don't have to go other places. Everything's done in one roof. All your follow-ups, all of your meetings, all of your care is done solely with me. It's not done with multiple doctors.
So when somebody calls your office and says, hey, I just want to know an estimate how much your implants, it's just not that easy.
It's not that easy because everyone's different.
It would be misleading to even give them a price, or no?
A lot of these places advertise, $8.95 for an implant, but that's just a bait and switch because that's not the cost.
That's just the cost of that little titanium
Exactly.
implant, possibly.
And because when
Is
you walk
that
through their
right?
door, there's going to be other extra costs.
So it's
that's gonna
misleading.
It is because
Does that
it's
frustrate you, by the way?
it is because that's false advertising. You know, patients need to come meet their doctor, see what they're going to be getting, so that they can be well versed as to, okay, A to Z. There's no hidden costs.
And you're competitive, right? We talked about this off camera. You know what the big guys are charging. You're not more than them,
No,
and you're an
I'm
oral
not.
surgeon.
Correct. I'm not any more expensive. I pretty much offer exactly, if not better, based on my training, a superior care for my patients.